And good morning. It's Harlem Emergency Network, our weekly update. Bob Ponce here with Carol Johnson. How are you this morning, Carol?
I'm well, Bob. How are you?
I am fine. So, our lead story this morning we want to talk about is New York City's Health Commissioner, Dr. Oxyrus Barbeau, resigns. And evidently, she has had some clashes with our mayor. And she made this statement yesterday when she resigned. She says, I leave my post today with deep disappointment that during the most critical public health crisis in our lifetime, that the health department's incomparable disease control expertise was not used to the degree it could have been. So evidently there was some clash with the mayor about them not really being able to fully utilize their own um, incomparable expertise in things such as contact tracing.
Well, that's interesting because that's what they've been doing for years. And to take that and now turn it over to the health and hospital system that is really still overwhelmed, and
Mm-hmm,
which is not their point of expertise, doesn't make a lot of sense. So, my
mm-hmm,
question is, are these people meeting? Are they like sitting in the same virtual room
mm-hmm,
and making some um, cohesive decisions? Because it seems like we're all over the place.
mm-hmm,
Contract tracing problem from its onset has been questionable as to how it's going to be done. And
mm-hmm,
I know that the community, myself included, spoke up about that. First, it was medical personnel.
mm-hmm,
Question why? Why medical personnel? These people don't know the people in the community. They're not sensitive to the needs and the concerns and just that demographic, different demographics, the LGBTQ community, the immigrant community, black and brown people. And so I just saw another situation like policing from out of the area, not knowing how to deal with people from other communities. So
mm-hmm,
that stopped. Then they were trying to offer the test online. John Hopkins was offering the tracing test online to become a tracer. That disappeared. It seemed like the same thing keeps popping up, but I'm not understanding why they would do that.
mm-hmm, mm-hmm.
But that makes it clear why we're in the state we're in.
Right, right. And um, the thing, and we've followed the Department of Health since the beginning of this crisis. We've obviously, as an organization, we've worked with them in the past. And while we have been critical in terms of some of the things that the health department may have done or not done, one thing is that I don't think we've ever questioned their commitment and certainly their expertise above other agencies in terms of this particular crisis. You know, Dr. Barbeau is a woman of color who was raised in New York City public housing and has had a lifetime of commitment, to the health of this city. And she's not a political animal, and maybe that might be her clash because she's trying to do her job. So this morning we salute you, Dr. Barbeau, and quite frankly, we have to say to Mayor de Blasio, you're on watch right now because it's not okay to politicize these positions. And I don't feel like he's made an effective case for the reason for her removal from this role. The one thing that we've been seeing on a local, national, and international basis is that when we get away from relying on the people who have the expertise and the science with regard to this, then we walk into dangerous waters. And the fact that we flatten the curve here in New York does not in any way excuse the fact that number one, we weren't really fully prepared for it, and we lost a lot of people here. And we still have to go back and go over what was done, and really examine where mistakes were made and be critically honest. Because if we suffer a second wave, we have to be prepared based on what we learned from the first wave. And so that means we're not going to whitewash or overlook mistakes that were made. They're not going to be held against people, but we have to acknowledge when things were not done in a way that makes sense. And one of the things that I think has disturbed us from the community level is watching the back and forth between agencies in the city and between the city and the state, and not seeing these entities always on the same page. And when lives are in the balance, it's just not acceptable for all our public officials to not be working together and on the same page.
Absolutely. And let's not leave out from the top. It said that when the head is off, all the members will be off.
Mm-hmm.
This administration down.
Mm-hmm.
And to leave it in the hands of the governors,
Mm-hmm.
each state is pretty much on its own.
Mm-hmm.
And half of the governors are saying, well, everything is okay, but meanwhile your numbers are rising. Florida, have they hit 500,000 yet? I know they were just a tad bit away from 500,000
Mm-hmm.
COVID cases.
Mm-hmm.
So they're
people still going out to the bars in Florida.
Oh yeah. Those things still haven't been restricted.
Mm-hmm.
So, and even though we may have not opened for indoor dining, the crowds are still gathering.
Absolutely.
The parks are loaded with people.
Mm-hmm.
Families are still getting together, and they're like, we're socially distancing, but yet we're all taking down our masks so we could put our heads head to head to take a picture. And this thing can move that rapidly, just jump from one host to the next.
Mm-hmm.
I think that once a governor stopped doing these real daily briefings to remind people, they got lax, everybody else got lax.
Mm-hmm.
And it's just not good. Even if the administration didn't step up, I felt that the governors across the country should have gotten together and met and created some type of a response. But if half of them are not willing to be concerned, and let's not leave out those governors who decided that they not only did not want to follow protocols, they were trying to take mayors to court for forcing wearing masks. Now some of these governors have been infected. And let's not forget the presidential candidate who was partying at the Trump rally with no mask, Herman Cain, is now dead.
Mm-hmm. And let's look at the timeline on that, because he was in Tulsa, Oklahoma at the rally on June 20th. He was in the hospital and tested positive for COVID-19 on July 1st and didn't make it to the end of the month. Yeah. And so it's a sobering reminder of how quickly this virus can move. And so even as we get good news, and for example, one of the good pieces of news that we got today is that we've gone 3 days straight without any COVID-19 deaths in New York. And that's great. And that makes us all very happy that we're seeing that reduction of the loss of life. but it does not mean that it cannot come back. And so we have to remain vigilant. I want to show a comment. We did get a comment from one of our Facebook followers. This gentleman, Ted Schulman, says effective, private, and compassionate community-based contact tracing has to be created through active community involvement. We are working on bringing this to Harlem. And he linked to a Silicon Harlem TED Talk that he participated in last Friday. And so we thank him for his comments, and we will see if we can have him, as well as another gentleman that was on the Tech Talk at Silicon Harlem, Dr. Olajide, I forgot his last name, but we're still going to try to have him on to talk more about the science and the methodology for contact tracing. And I think what he brought up is important. And we bring back the contact tracing because that was apparently the issue of contention with Dr. Barbeau, where the contact tracing was removed from the Department of Health and given to New York City Health and Hospital Corporation. Now, New York City Health and Hospital Corporation has a lot of fine medical professionals, but their focus has always been and continues to be running the hospitals. And the skill set to do epidemiological contact tracing, you don't just get that. You can't do that with a 30-minute training and a PowerPoint. There are people who have been studying this for years in order to be ready to react in this type of situation. And it just seems to me that those are the people who should be leading the charge. And if there needs to be a scale in terms of adding more people on to do it, it still should be focused and run through the people with the expertise to make sure that we're not missing any steps or doing things that should not be done. So we're going to keep an eye on all these things. Keep our watch out. That's what we do.
And so, I'm sorry, Bob.
No, go ahead.
Yes, with the hospitals, there's not a lot of talk about the after effects of COVID.
Mm-hmm.
Those that have survived, those that will have lasting pulmonary problems, particularly Black and brown communities, people that don't have insurance.
Mm-hmm.
Those hospitals will be inundated with patients.
Mm-hmm.
How many people can they really free up to do this? Whereas the health and the Department of Health, their focus was on measles for a long time, and they haven't dropped the ball on that. They're still keeping an eye on that in case it pops up. It's not gone completely, but that's what they were focusing on. But now they were prepared to take a large portion of their force and work in this area. So you're going to have more and more people running to the hospital more than before. Because these were people that didn't normally go to the hospital for treatment anyway, simply because they didn't have insurance. But now, just yesterday, I was talking with someone who's in aid, and they was talking about how there's so many cases where people are getting really, really sick. Elderly people are getting really sick. Just went into the hospital last week. Came out of the hospital last week, I'm sorry. Mm-hmm. And already they have to go back because they're beginning to experience symptoms again. So a lot of these people who managed to get over that first hump, they're going back to the hospitals. The mm-hmm. hospital has a job to do already.
Mm-hmm.
Why would you overindulge them?
Mm-hmm.
It doesn't make sense when you've got and that's the thing about this entire response. It makes no sense.
Mm-hmm.
Absolutely no sense.
No sense at all. So in other news, we see that Rhode Island has been added on to the quarantine list. And by the quarantine list, evidently everybody's quarantine list, certainly New York, but not only New York, New Jersey, Connecticut, and Massachusetts have all turned their backs on Rhode Island, poor little Rhode Island. But evidently their numbers have gone up sufficiently that, all their neighbors are like, you got to quarantine if you come from Rhode Island. And I think this is kind of ironic because early on in the pandemic, Rhode Island tried to quarantine New Yorkers coming in, and and Governor Cuomo threw a fit on this. But evidently, now that the tables are turned, we understand. I haven't really looked at their numbers, but the fact that 4 or 5 states have added them onto a quarantine list, that's not a good look.
No, it's like, Rhode Island came in and, they brought their ball and said that New York couldn't play. And now it's now that their ball is flat.
Right.
Now you can't play.
Right. Yeah.
I mean, what kind of games are being played here?
Right. You need to go in the house. Your mama calling you.
I mean, sometimes you have to laugh about these things. We don't take ourselves too seriously, but we got to take life seriously because we really like to continue to live it.
Mm-hmm.
Yeah. I have noticed certain places, like we were on 125th Street. Mm-hmm. Bob and I noticed that there wasn't as much crowding in that area as it had been, over the past months. You could barely get down the street. So, I'm not seeing so many people out, even in this area. I'm not seeing as many people. So some people are getting it. Mm-hmm. People are getting it. Folk, we are not out of the woods. Mm-hmm. We are not out of the woods.
So I also want to bring back a topic that we've talked about since the beginning of this pandemic. And it's why does vitamin D get no respect?
Or vitamin D.
We started talking about the use of vitamins early on to boost your immune system. We never said it was a cure. It's obviously not a cure. But it's obvious that a boosted immune system gives people some protection against this virus. It's not magic, it's science. It's not even new science, it's settled science. So I'm still not understanding why, with the numbers raging and, approaching 150,000 dead, that there is not more regular advice to the public about boosting up your immune system using vitamins that are readily available pretty much to every American, and just recognizing that there has been a correlation between vitamin D deficiency and COVID-19 death rates and comorbidities. And so it's just simple common sense that our health officials would urge people, among all the other things. You're urging people to wash their hands and do social media protocols. So we're talking about all of the external protections, but why do we not talk about some internal protections to help build up our bodies to be able to effectively do what it does? Because the thing is, there is actually no cure per se for any of these viruses. Even the vaccines are not cures. What the vaccine simply does is help the body to recognize the virus so that the body's immune system can fight the virus. It's the only thing that's going to kill the virus is the body's immune system. So if we know that that's the destination that we want to get to, why are we not helping that?
You would think that because this is novel, it's brand new, you've never seen it before,
Mhm,
that the authorities would push that.
mhm,
Do whatever you can do to stay out of the hospital.
mhm,
Whatever, you know, if it means taking vitamins and popping pills, because, we had that conversation before. You have
mhm,
people that will take a vitamin before they eat a healthy food.
mhm,
And you can't expect them to all of a sudden just change their diet overnight. I've heard it thousands of times. Well, I'm still going to eat such and such. Okay, do something. They should be pushing that you do something to keep from having to make that call for the EMTs. But no. And this is a health crisis. So you would think that you would take 2 minutes at least to constantly enforce the possibilities that you can keep from getting sick if you just boost that immune.
mhm.
There's nothing. We get crickets on that.
Yeah. And a lot of these things are the reasons why there is a lack of trust about our agencies and about our healthcare system, because it seems like and I'm not saying this is across the board true, but in many sectors in our healthcare system, both public and private, it seems like there's more an emphasis on managing illness than on being healthy. And it's just no longer acceptable. We cannot have communities that continue to be ravaged because we're not emphasizing, complete health practices. And that's prevention, not managing it when it gets here, or waiting for the illness to show up and waiting until it's in its major stages of attack before that we then try to implement solutions. And at that point in time, your body is already in the midst of the fight, and it's like going to a raging fire and you give somebody a little squirt gun to say, hey, you can put it out with this. It's a little late for that.
Absolutely. And for every illness, there's always a follow up.
Mm-hmm.
Whatever you are treated for, you have a follow up appointment. Now, if you have so many people who've actually fought COVID off, who already had the comorbidities, something that was already wrong with them is going to exacerbate, because this COVID is such a sneaky creature,
Mm-hmm.
and it attacks so many different organs, and it creates so many other situations. So if you have somebody who did have these underlying illnesses, they fought COVID, you can hurry up and believe they're going to have a lot more problems. We have yet to hear one thing about follow up treatment. If you've had COVID, you may have fought it off. Are you still feeling this way? Are you still feeling that? Have you noticed anything different? You know, have the other situations that you already had now changed, morphed into something else? There needs to, we're in a pandemic. How in the world can you not have aftercare? It's just like, okay, you survived it, go home. Leave us alone. Just go home. I mean, there's not even anything like look for certain things. I don't know anyone who survived this thing and was told, when you go home, look for certain things. If certain things happen, we need you to come back. Catch these things and nip them in the bud. How in the world can you not have an aftercare system in place?
Mm-hmm. Mm-hmm.
And
And
I'm sorry, go ahead.
well, yeah, this just emphasizes, and it's just kind of wraps around to where we started. And so obviously, there's a lot of information that we've had to absorb in a short period of time. and we need to be able to disseminate that information back to people so that they can make rational decisions. And that's why taking, our top health professionals, out of the middle of things, in the middle of this crisis, and we are still in the middle. We're not at the end of the crisis. It sounds great. We flatten the curve and all that, but the simple fact is we know the history. It happened in 1918. They had a first wave and everybody went back to normal. And then the second wave was bigger and worse than the first wave. And they say, if you don't pay attention to history, you're doomed to repeat it. Right. And it seems like that's the course that we're on now, is that we're ignoring history. And if we don't use common sense, we're doomed to repeat that history. So we will continue to press forward on these issues. I think for the month of August, we're definitely going to go back to square one and talking about immune boosting and how do we prepare ourselves now for the potential for a second wave coming in the fall. And so it obviously means boosting our immune system. It also means all the resources that we didn't have in place for the first time. Now is the time to stock up because there's no telling as to whether there'll be another shutdown or not. Nobody wants to see it, but it's better to be prepared for it and ready for it than to have it hit and knowing what happened last time to not be prepared.
Yeah, that's the scarier part about this, that it's new to you, it's new to the governments, I get that. But it's new to everyone. And we have to look to somebody for some common sense answers.
Mm-hmm.
And I don't see where we're getting them. When we're looking at the so-called next wave, and then we have to add in flu season, and we'll still be in hurricane season. There's a lot of things to consider. And the less that people have to worry about, the better. Because, come on, let's face it. This thing is mind-boggling to everyone.
Mm-hmm.
You need real answers from the real authorities. And, I'm thinking, neither one of us are rocket scientists, but if we're thinking these things, and we are the public, and other people are thinking these things, and they are the public, it's time for you to come out and put the public at ease instead of just counting the deaths and telling us how the curve has been flattened. And now the cases are rising again.
Mm-hmm.
But there's still other things that need to be considered. And if you have somebody that's post-COVID and they go, what's going to happen to some of those people when they move into this season? When summertime is over and everybody's forced to go back in the house,
and
you still have these other things, we just had a tropical storm yesterday. We're still in hurricane season. So the more you can give us to put our minds at ease, the better. I don't think that's on the table.
Mm-hmm.
I think it's more like, look, I'm the authority, just trust me and you'll be okay. I don't know about anybody else, but that's not good for me.
Not good here. Trust is earned.
Yeah, your job is you're in that position because we're supposed to be able to look to you for some answers. And it's just go on about your business, do whatever you have to do, and wear a mask, wash your hands, and just be done with it.
Mm-hmm. So, the numbers speak for themselves. And so if we're going to hold the president accountable for the 150,000 deaths that happened on his watch, it also means that we have to hold our mayor and our governor for the 23,000 deaths that happened on their watch here, which is a way proportionally bigger number than our population would suggest. And We understand that there are factors in New York that make it more susceptible. We get that, but we have seen the operations firsthand. We have seen the communities where the testing has been spotty, where the resource allocation has been spotty in the early part of this pandemic, when things were ravaging in Harlem, the Bronx, Queens, and they opened up facilities in Central Park. These are the types of inequities and resource allocation that directly impact our communities. And we're not standing for it anymore. We are not standing for it. And so we will continue to be here every week, whether the governor does his thing, whether the mayor does his thing. We're going to be here to talk about it. We look at the science. We talk to experts. We're not doctors, but we got a doctorate in common sense.
Yeah.
We got the master's, the PhD, the doctorate in common sense, and we're going to continue to use it and share it with this community until we get the answers that we need to make sure that we can operate and live our lives in a safe manner.
Absolutely. So that still leaves it, as it's always been, up to us to do the best that we can to keep ourselves protected, but more so keeping people around us protected, and not relaxing the protocols. Please continue to sanitize those much used surfaces. Continue to wear masks. There are some stores where they don't want you to come in with gloves. I understand, because they don't know where you've been and what you picked up on those gloves wherever you've been. But please continue to wear the mask. Please continue to socially distance. And young people, you can get it and you can die from it. But you can pass it on to your family members, your siblings, your mother, your grandparents. You can pass this thing on. Don't be fooled and get it twisted. Now, we know that was ingrained in the beginning, but as they said, it's new. But there are children. Oh my goodness, how many kids did they have in Florida? Like 50,000 last time I checked, that have COVID under the age of 1. So yes, you are as vulnerable. You're 19 years old. You're as vulnerable to getting this as an 80-year-old person. You are just as vulnerable to get this as someone who's 80 years old with multiple comorbidities, diabetes, high blood pressure, just to name a few. Please. I know it's not cool, but it can't protect you if the mask is under your chin. It can't protect you if it's over your mouth and not your nose. It has to be a good, firm grip. So please, I'm seeing too many of you putting your life at risk. This time next year, we want to see you.
And on that note, we're going to wrap up our broadcast. We're going to remind you, if you've got information you want to share with us, you can send an email to harlememergencynetwork@gmail.com or leave us a message at 347-916-6119. If you're watching on Facebook, please like us. If you're watching us on YouTube, please subscribe to us and join us again. We'll be back next week at 9:30 with more pertinent news and information for you.
Everybody continue to stay safe. Have a wonderful, wonderful week.